Someone would find a therapist like me who specializes in addiction through maybe speaking to their provider in the Columbia system because they know that I'm out there. They might also find me by researching online for an addiction therapist or researching a specialty in addiction with a mental health clinician. That would be a referral to me. So I would get to know what's out there in the community. The first thing I would get to know as a dentist would be what hospitals are in the area. This is, I think general practice in case there's an emergency, where could I send a patient to? And also knowing, if there's an urgent issue, where do I send a patient and do they have substance use services? So I might reach out to a hospital that's nearby, that I trust, where I can get some more information about substance use and their addiction services. I might also ask the hospital, is there anyone you can recommend in the community that treats substance use disorder? I'm a community provider and I'd like to be sure I have resources for my patient. Also NAMI, which is the National Alliance for Mental Illness or Mental Health, and SAMHSA, which does a lot of services around substance use, I'm sure would be glad to hear from dentists reaching out saying, what community providers could you recommend to me for individuals struggling with mental health or substance use?
When it comes to opioid abuse or prescription drug abuse, I think it's more so a referral. I think we usually, because of the complexities of that kind of drug abuse, especially in our clinical setting, that we more readily refer the patient to those that can help them with that addiction process. Well, I think a lot of our referrals probably are internal, especially because of the patient populations that we work with in FQHCs, that we have places that they can go within to help them with addiction. But if we don't have access to that, or you're not working in that type of comprehensive care facility, a lot of places, especially on a city basis, you can refer a lot of patients to once you get the information. So I guess it'd be as simple as just going on the internet and looking up places in your city that can help people recovering addicts. So it's something that is being addressed on a wide scale, and the taboo of it, or the secrecy of it, or how people used to have to suffer in silence with this is starting to be unveiled.
There are times when obviously whatever you need another provider to do is out of your level of expertise, but I think it's really incumbent upon the dentist to make sure that everything about the referral is handled by them, because it comes back on you whether that referral was, again, I use the word seamless, or whether it was an enormous hassle and a problem for the patient. So in my office, we made sure that we did all the phone calling while the patient was standing right there, and made sure that everybody was comfortable with the outcome of the referral and the conversation. I think as far as referring patients using a referral line or referral source by a third party, I think it's better than nothing. But I think that, again, I think it's in everyone's best interest. There's nothing like a personal referral for when you walk in, that the providers know who you are, where you came from. I don't think there's any question that whether it's intentional or not, the level of care you get from a personal referral is definitely going to be, I think it's definitely going to be better.